Harold, you've been involved, and maybe introduce yourself as well. You've been involved in a lot of places where there's varying different shocks that are occurring, and then they have an impact on nutrition and health. Can you describe a little bit what that looks like, just briefly?
I would hope that in this room there's nobody who doubts that malnutrition doesn't have a long-term lifetime consequence. And as a child who is in weaning age, when there's a drought in the community or when there's an economic crisis in the community, has a very high likelihood of being affected all through their adult life. And if this is something that you aren't yet convinced on, catch me at the coffee break. I'll be glad to discuss it, but I won't go over the data here now.
And these don't have to be catastrophic events, though.
No, they don't. Sometimes just the shortfall of rainfall of 15-20% can make difference, and there's evidence on that. I wasn't going to talk about that evidence, remember? We had talked this morning about the best way of dealing with this is to prevent the crisis. We use the analogy, don't let the tree fall over. Let's show some humility. Mankind is not going to prevent nature from dealing us hurricanes, droughts, floods. We are maybe going to slow down climate change. We're not going to prevent climate change. There are going to be short-term and long-term shocks that will affect nutrition. So the question first I want to ask, what do we do in the short term? A child is in the environment that is hit by a disaster of some form. One approach where in the last decade great progress has been made is the management of acute malnutrition. A child who is acutely malnourished, and you can measure them by thin arms or by very low weight for height, has a very high risk of dying. If they go to a rehabilitation clinic, a good chance that they'll catch an infection from the child down the way with in the clinic and die of that illness. What they now progress is to have community management of acute malnutrition. And that is far less expensive, less risk of catching infection. And what they're using to address this is high-density lipid-based supplements which can have a very long shelf life. There are now studies to say, well, can we use this in a preventative manner? Because that's what I was just discussing was curative. We'd rather prevent than cure. There is not yet strong evidence, but there is some evidence that using a similar type of lipid-based nutritional supplement as part of a disaster package. Most drought relief or flood relief packages are for the household. Their markets have been disrupted, their livelihoods have been disrupted. They address the household, either with a cash package or a food package. In addition, a nutrition supplement designed for the weaning age child has a good chance of preventing malnutrition. So that's addressing the short-term crisis. We aren't able to prevent the crisis. We may be able to prevent some of the consequences.
Okay. So I'll come back to you on the
one more line. Unfortunately, with our best efforts right now, with all the programs we have in the world, there's well over 100 million malnourished children in the world. When I'm allowed back to talk, I'm going to discuss what do we do about them? When they are malnourished, what is the next step?